Up on Senator Murray's question about referrals, in particular into the private sector, you made, I wrote down this in your statement, you said y'all had recently made 543,000 referrals for private veterans for private care. What percentage of those would you guess were mental health referrals?
I'm sorry, I could hasten a guess, but I would take that one for the record.
The reason I asked that question is I got into the Atlanta VA starting in August of last year when we had 2 suicides and a drug overdose. When we dug down, and they were using a community-based provider for mental health, VA would see the patient, refer them to the community-based provider with no follow-up between the referral and the appointment. And during in that period of time when the person was determined to be at risk for themselves and their own life, in 2 cases they took their own life because they didn't get timely services on the referral. I think is it Matkovsky? Mr. Matkovsky made an interesting observation about coordinated care. As we expand private options in veterans health care, which we may or may not do, I hope we do in terms of the legislation going forward, care coordination is going to be one of the secrets to making that work, not just in reducing wait times, but in reducing the quality of care or increasing the quality of care to the veterans, particularly with the number of, as Chairman Sanders said, the number of mental health people coming forward. That's going to be an ongoing process. It's going to be one that's going to have to be coordinated and going to have to be monitored. My question, did you ever see the William Schoenhard memorandum? In May, when Secretary Shinseki and Dr. Peters were here for a testimony, I asked them both the question, had they seen it? Dr. Peters said no, he had seen it and read it. Secretary Shinseki said he had not. I think both of them told me the truth. I don't think Secretary Shinseki ever saw it. And I don't think he ever saw it because I think the senior leadership of the VA didn't let him see it. I think my experience in a lot of this problem is it lies at the highest levels of the Veterans Administration, Veterans Medical Services, that insulated the leadership of the VA from the problems that they had. Why else would a memorandum written 4 years ago describing what we're all discovering now in 2014 not have been acted on? The last sentence of the 3rd paragraph says, these practices will not be tolerated. It doesn't say, look at this when you get a chance, and it delineates each of the programs just like the testimony of the whistleblowers did the other night in the House hearing. You're an interim director or an interim secretary. You're going to be handing off, presumably, to Mr. McDonald, who I understand is a well-qualified individual. Yes. What are you doing to put in place the type of information transfer and conduits that will see to it that Mr. McDonald doesn't become a rookie victim of what a distinguished general was in terms of Mr. Shinseki?
Yeah, I'm not going to let him. I'm not going to let my old friend become a rookie victim of anything. More fundamentally,
let me interrupt. I'm not being trite when I ask this question.
No, I understand.
For 4 years, the VA has insulated its leader. In the case of Secretary Shinseki,
I would tell you from my own personal perspective, I've learned to never have all my information filtered through a couple of people, and so from the first day that I got to VA, I started reaching down in the organization to get additional information. I think your sense is a very accurate one. I think historically VHA has operated a fairly insular organization, not fairly, a very insular organization. And I think part of what we've been doing is dismantling a lot of those barriers. Since my first day as acting secretary, every single morning at 9 a.m., we have something called Access Stand-Up. We got senior leaders from across VHA as well as senior leaders from across the department. We're up in our Integrated Operations Center and we're boring into data around access to care. What's the status? What are we doing? How many contacts? How many appointments? What are the wait times? What's the status on many of these different initiatives that I've alluded to in my opening statement? It's just part of what we're putting in place. I would have to say this young guy right here, I've said before, if I was half as smart as Philip, I'd be darn smart. He's been doing an awful lot of the work to put in place the kind of management information that you're talking about, so that we're not just relying on that by chance that information filters up, that we've got dashboards in place that will help us identify where there are scheduling malpractice that's in place right now, where there are productivity opportunities for us to wring more productivity out of a particular clinic, that we're able to identify those things. And then in tandem, requiring medical center directors and visiting directors to get out in their clinics so that they take direct ownership for the consequences. The first sentence in the memo that provided that direction was, medical center directors and visit directors are directly accountable for the quality of care and the timeliness of care that's delivered by VA. That was the first sentence, and it was in there because I wrote it. That's part of ensuring that we've got that kind of accountability, and frankly, it's part of the culture change for the organization. VHA is not used to operating that way.
Well, my time's up, but with that endorsement of Philip, I have to ask this question. Philip, you're not leaving when Secretary Sloan leaves, are you?
I'm not going anywhere either. I'm going to stick around, so.
I'm talking about in the leadership.
Oh, that's,
Make sure he's at the right hand of Mr. McDonald.
There are a lot of good people. There are a lot of good people building a lot of good tools. One of the things that we have a team working on right now is to actually take that memo and actually develop tools that allow us to mine data to look for those patterns. So give us a risk score at the timeliness data that we're looking at. So as we're looking at our timeliness data, Secretary Gibson has directed us to go look at an integrity score against it and just rate it. Are there certain questions? And if the questions persist, then have an audit come in and take a look at it and manage it.
Thank you both very much.